The reason we prefer microneedling is it's going to stimulate collagen, elastin. So today we're going to use it in scars and in stretch marks, and so we're going to get started with that. I first start out with my microneedlings of anything by starting out by misting with copper HA mist. It's especially important to mist the area well because it's going to help absorb any product that you put on, whether it's hyaluronic acid or any other serum. It helps to absorb that as you start your microneedling process. It actually holds in 80 times its weight in water. It's not new to our bodies. Our bodies have HA in it. It's nothing new to us. I'm gonna get started, and I can start at about 1.5 millimeters of depth on the stomach, so I'm gonna get started here. And she's gonna tell me if it's uncomfortable, and then I'm also gonna be very mindful about where I numbed her. And so I'm gonna start right here, and I'm gonna be using my PRP, and I just dip it, my fingers right here, and I cover the area with my PRP. And again, this is the platelet-rich, not platelet-poor kind. And so I'm gonna be using my hands to keep her skin taut, and I'll be going out like this. And she'll let me know if it's too uncomfortable for her. How you doing? You want to move it about 1 inch per second. And I'm starting at the core of her body and moving outward. Because I'm following the lymphatic system, and that makes a difference. When I see that things get dry, I tap my PRP and just rub over here a little bit more. Then I'm going to go in a vertical position. The patient will be given very clear post-operative or post-procedure instructions, such as hydration, keeping this area nice and moist. Oftentimes, if they use PRP, we send them home with the rest of their PRP that wasn't used to apply for up to 6 to 8 hours after the procedure. Again, I'm going from the core out in a diagonal motion now. This is called the crosshatch method. This is creating microchannels in the skin, allowing the PRP to dive down deep into those microchannels and do its work. So I'm just going to tap that area right here with some extra PRP, and I'm going to move to my next area. You doing okay? Mm-hmm. I can tell she feels it because whenever I drop my pen on her skin, I can see her abdominal muscles react. So she will feel this, and my patients always can opt to use the nitrous if they desire. I'm going in from the outer core in a diagonal motion again. And And she's doing great. And I can see where my outline is simply because of its redness. It's okay if you get a spot of blood. That's okay. It just means you're down to where you're supposed to be, but it should not be profusely bleeding by any means. And then oftentimes, as you go through your next treatment, we increase the depth of our penetration. So now what I'm going to do is I'm going to look for these areas where I can see the actual stretch mark, and I'm just stamping right now. These are the glistening areas that are silvery, and just stamping. And this should just be the last kind of buffing, is kind of how I would perceive this last measure. And you don't want to go over it too much. And that looks good. I'm just going over it on this side. And as you know, stretch marks are going to go with the lines of your skin called Langer lines. And she's done great there. Okay. Now we're going to move on to these other areas right here. This is a small scar, and I'm going to stamp this scar right here. This is from a surgery she's had before. It's very small, but it matters to someone who can wear a bikini sometimes. And then this is another one. And these are so small, they're too small to really do that crosshatch method. And again, I'm just putting more PRP glide on as we keep going. And she's doing great. You're okay? Mm-hmm. Okay. And this right near the ridge of her belly button is just a little, what I would call hypertrophic scarring. And this is just where the tissue gets to be a little bit overzealous in a healing process. When it gets to be really bad, it's a keloid. That's not a keloid. This right here is not really a keloid. You okay? Mm-hmm. And if I have a little left over of the PRP, I might inject underneath right there when we do this other scar. So we've got 1, 2, 3. I think there was one more right here. It's real hard, it's real silvery. And then you can outline it sometimes to make the scar shrink. This is not a very large scar, but we'll do that. Okay. We're going to be starting now using the PRP. And I'm going to trace this first with the microneedle. And then something like this, I like to go in this kind of a method like that to kind of shrink the scar. And then what we're going to do is inject just underneath the skin directly with a needle. Again, I'm still moving at about 1 inch per second. Going all the way around and up. Being mindful of how much I numbed her, which is about 1 centimeter on either side of the scar. And when I first saw her scar, this actually was oozing. So I really think it's improved. So I'm just going to stamp over it now. And that's it for that. I'm not going to combine the PPP and the PRP. I'm going to let them be separated. So she can use this first and then the PPP second. Post-procedure, you always want to keep this as lubed up as possible. Okay. Platelet-rich plasmas will be good at room temperature, or at any temperature really. You need to keep it at room temperature for about 6 hours after it's harvesting. So she will apply this every 30 minutes, every hour until it's gone. And so that's that.